Welcome back. Expanding telehealth services. President Trump signed executive orders to improve access to doctors amid the coronavirus pandemic. Watch.
The order builds upon a series of actions we've all taken to make telehealth available to all. We ensured that Medicare covers telehealth visits at no additional cost. That's no additional cost. And co-payments can be waived for telehealth services. We are working very hard also on prescription drug prices.
Joining me right now is Health and Human Services Secretary Azar. Mr. Secretary, it's great to see you this morning. Thanks very much for joining me.
Good morning, Maria. Good to be with you.
Well, great idea on telehealth services. Obviously, we need it given this shutdown. Tell us if you believe that this is as effective as meeting with the doctor.
Well, absolutely, it's as effective in many circumstances. Now, there'll be times where you need to go in and see the doctor, but this unleashes a whole new way of delivering care in America that brings us really into the 21st century. You know, as part of President Trump's historic response to the coronavirus, he ordered me and the Department of Health and Human Services to unshackle health care from so many of the artificial regulatory barriers that had stood in the way of better care, lower cost, and more choice for people. And telemedicine is one of those areas. You know, now, as part of the coronavirus response, from your home, you can connect with your doctor, your hospital. You can get so many services delivered, so much diagnosis to take place, prescriptions to happen from there. And what he's ordered is that as much of that as we can do by regulation to keep that going even after the coronavirus.
How do doctors feel about this? Are they looking at a decline in revenue, and is that causing them to do anything different? I mean, I know that some doctors are readily available and are, agreeable to do things on the phone and certainly to be in touch on text and emails, but not everybody. So how does one reach the doctor, and what do the doctors have to say about this?
Well, I've been traveling all around the country. I've met with hospitals and doctors and patients, and telehealth has just in a few short months become so embedded in the workflow of how we deliver health care. I think if somebody tried to unwind the clock, they'd face a revolution at this point. Patients find it more convenient. Doctors are finding it convenient. You know, the key is they can get paid now for those services. So whether it's the phone call, the Skype, or the FaceTime, that's a critical difference. We're going to have Congress step up to the plate, though, because there are still in statute many artificial restrictions that have kept health care from developing into a modern system. But, you know, we went from 14,000 Medicare telehealth visits a week to 1.7 million a week by the end of April. So this is something that our seniors and the rest of us are not going to want to give back.
That's terrific. All right, I want to ask you about this supply chain concerns from China. But before I go there, Secretary, what can you tell us about the coronavirus in terms of these worries over spikes? Where are we right now in terms of this virus? Are you expecting a second spike in the fall?
I don't really think it's useful to talk about second waves or that kind of thing. What we're seeing is emerging outbreaks and effective tactics that can actually get at those outbreaks. If we all do our part, if we wear face coverings, practice social distancing, use good personal hygiene, avoid situations where we can't do those things like overcrowded bars or overcrowded indoor restaurants and household gatherings of too many people. If we all do our part, we can remain open, but turn around these infection rates. We've seen it in Phoenix. We've seen it in other communities. And now the majority of our states are in a plateau or declining position, but we still have to be very vigilant, all of us, and we have to look for early signs of outbreaks and tackle them right away across the country.
So it leads me to the question about masks. The Wall Street Journal is reporting the FDA's effort to shore up supplies has resulted in masks coming into the country of varying quality. Secretary, some states have stopped using some of these masks because the FDA sparked confusion about which Chinese masks can be trusted. So what should we think when we've got all of these foreign masks coming in and maybe the ones from China can't be trusted?
Well, I think that's actually an example of the flexibility and regulatory nimbleness that Commissioner Hahn has brought to the FDA. You know, this actually dates back to March, when we were in the throes of the outbreak there in New York and Connecticut and New Jersey, and facing shortages of supplies of N95 masks. And what the FDA said was these KN95 masks, which come from China, it set up alternative regulatory pathways for them to come into the country, including if it was a reputable operator, if the product was approved in reputable countries other than China, or if there was independent data validation behind it. What we found, though, was that on inspection, some of the manufacturers were not reliable and they had not actually gotten that independent test verification. FDA quickly removed those products from the market. So I think it just shows that FDA has, under President Trump's direction, been very nimble, very adaptable to meet this unprecedented pandemic.
This whole worry about getting things from China that we need so much, whether it's prescription drugs and 70% of the active ingredients in our prescription drugs made in China, or this mask issue, how long do you expect it to take to start firing up our supply chains in the U.S. so that we could actually produce some of these things here and we don't have to be reliant on Chinese goods?
Yeah, so Maria, in terms of personal protective equipment, the president's used the Defense Production Act, and we're already scaling up domestic manufacturing capability, domestic raw ingredient, active ingredient capabilities for those. In terms of pharmaceuticals, you know, we had a really historic announcement last week where we're going to be standing up the Kodak facility there in Rochester, New York for active ingredient manufacture. We're going to really work with our world-leading biopharmaceutical industry to onshore more generic manufacturing, more active pharmaceutical ingredient manufacturing. And a lot of that's going to be possible, as you know, Maria, thanks to the president's historic tax reforms that got rid of the confiscatory taxes the United States had that forced drug companies really to manufacture in other countries. Now that the president has fixed that, we can onshore capital investment, onshore jobs, and we've seen that across the pharma industry. It'll take some time, but the president's committed to onshoring the pharmaceutical and PPE manufacturing as really part of our core strategic capabilities.
Yeah, it's a really important point. We've been talking about that as well. So, Secretary, when looking at the spread of coronavirus, Task Force Coordinator Deborah Birx is warning that it is extraordinarily widespread and that rural areas need to take precautions. Tell me about the issues in rural areas. How concerned are you about where the virus is headed? We've been talking about crowded big cities, and now we're hearing that people who've left the cities and are in the country are also contracting this virus.
Yeah, I do think it's important that everybody be vigilant. You know, since so much of the outbreak initially was focused in the New York metro area, and even some of the recent outbreaks we tend to talk about big metro areas like a Phoenix or a Miami or a Dallas or Houston, but it's misleading to think that it is contained just in those areas. People travel into areas, they go on vacation, they come back to rural communities, and we have so much asymptomatic spreading of disease. I think the message is for all of us. It doesn't matter if you're in a small town in rural America, wear face coverings, practice social distancing,
yes,
use good personal hygiene, don't go into bar settings that are overcrowded where you're not going to be able to do those things, don't have family gatherings of large numbers of people at your house, because these are the tools we have as individuals to keep our country open, to allow us to be back to work, back to school, back to healthcare, back to worship.
I mean,
and if we don't, you end up with shutdowns.
It just sounds like we're going to be living with this for a while. Secretary, several companies, of course, have been tapped to aid the White House in terms of the Operation Warp Speed. Will the U.S. be ready to distribute once a vaccine is approved?
Oh, absolutely. We'll harness the existing CDC systems of distribution for vaccine, the commercial systems of distribution, and of course, we're bringing the entire logistics capabilities of the Defense Department to bear in the unique partnership of Operation Warp Speed. So absolutely. But, you know, Maria, we were talking a bit about the steps that we as individuals can take here with the current outbreaks that we're seeing. But, you know, we're just months away from tremendous promise here in terms of therapeutics and vaccines. You know, we already have remdesivir, steroids, convalescent plasma, thanks to the president's leadership. We have monoclonal antibodies that should come in the next several months. We've got a contract for 70,000 to 300,000 doses just from Regeneron by the end of September, early fall. So many advances that should have us all very optimistic about the months ahead.
We'll leave it on that optimistic note. Thank you, Secretary Alex Azar. We'll be right back.